Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Annav Vyadhi and in last lecture we have focused on the Parinam Shul. On the same track we will discuss today Shul. Now in Ayurved when a single Shul word comes it is always for the udarsh and when Shul is mentioned for pain in any other organ or site, that organ's name is attached with the Shul word like Sandhi Shul, Kati Shul, Amsa Shul, Root Shul, etc. So, by plain Shul word, it is expected that it is Udara Shul or we can say pain in abdomen. Now, Udara Shul, this symptom has a tremendous range of diseases in the Kaya Chikitsa, in Shalyatandra, in Stirotpasuditandra. But as we are discussing Annav Vyadhi, I will restrict this pain in abdomen or Udarashula up to Annav Vyadhi only. In future, when we will come across the surgical diseases or Shalyatandra or Stirotpasuditandra, in that at that time we will consider Udara Shul in that aspect. So Shula, Udara Shula as a disease of Annav Vyadhi, very commonly seen feature and patient often complain. The differential diagnosis about the Shul, firstly the very common thing is Samata. Patient has eaten a much more thing or adhyasana etc. and that's why that pain has been started. In that case, you have to diagnose of course the Samata by Jiva Parikshan or the Lakshana of Am and then the Chikitsa will be obviously Am Pachan. This is the first type of the Udarashul which is very commonly seen. The second type of Udarashul is because many times because of Adman. There is a flatulence, patient feels that there is tremendous air accumulated and that air pressure causes pain in abdomen. In that case, Adman Nashak Chikitsa, again Ampachan plus Lavanakalpa are very useful. All of us we know that. Third type of pain in abdomen which is also very common. Now first two which are mostly related to the or mostly not, they are related with the Anna for food, whether it is Samata, whether it is indigestion, and because of that Amajirana and Udarashul or Adnan and Udarashul are seen. Many a times patient complain that there is no any relation with the food and patient typically tells you or you have to ask it whether it is a pain like a spasm, there is a spasmodic pain and it is not related to food, whether it is patient empty stomach or full stomach, anytime that pain starts and patient is very gets panic because of that pain. Now this is the stamba inside and that's why the muscles of abdomen or even there are GI tract soft muscles get stiff anytime and then that typical area starts paining. Now here also we can say it as a stamba lakshan and for that Lavanakalpa like Bhaskar Lavan, Hingvashtak, Samadadi Churna, Shankhavati are very useful because Lavana Stamba Sangha. So that cramps which come in the abdomen and patient starts paining, in that case the Lavan Kalpa are very useful and I have experienced it in many patients. In all these types of patient, always think of the habit of food and type of food. You will find Rukshanna Sevan is one of the common hetu which is found in the patients which triggers the pain. Rukshanna Sevan, lack of water. Now you will you must have come across many people which have a misconception about the drinking of water during meals. Some say you should drink before 1 hour. Some people will say no, we should drink the water after 1 hour. There is a misconception in the society that water should not be taken during the meals. It creates many problems, and this lack of water during the food is one of the major reason found in the patients. So when you are giving treatment about ampachan or lavankalpa anything, always think of the hetu which is seen in which is the causative factor for this pain in abdomen. First thing. Secondly, adhyashana, ajirana. This is another common factor. Patient eats tremendously without any control, and that leads to ajirana and udarsh. So again, you have to convince the patient about the food habit. The another common factor which is you may get astonished why I am saying this, but I have seen in some patients that lack of food. There is lunch time about 1 o'clock. Patient is lazy about that, or I will finish this work, and I will eat. And there is a much more gap between two meals. I have seen the patient which eat at night in full fledged as a dinner, and in morning they eat in the 3 o'clock, 4 o'clock. That too sometimes just junk food or just chai, tea 2-3 times, and again at night. So this a long gap of between the two meals or two food is also seen as a trigger factor, and this avkasha increases vata dosh and vata prakop is seen. So like adhyashana, anashana is also seen in some patients which is to be taken care of. So in all types of, not in the case of udarshul, but in Anno-Sudas Vyadhi, always remember only treatment will not help as a 100% chikitsa unless and until hetu parivarjan is achieved. So in these patients, along with the medicines, you have to give time to the patient and ask about the food habits, and you have to convince about the proper ahar vidhi visheshayadana. Unless and until you do that, the patient will not have a complete relief, and there is recurrence of the symptoms. In all these cases, in the case of all types, fermentation with the hot water tapasvet water bag is seen to be very useful because it immediately stops the pain, and hence in Bihar, or you can add this point also. So in case of udarshul, always remember the causative factor, lavankalpa, ampachan, warm water to drink, and even if there is pain is recurrent, you can apply any vedana shamak tel on the abdomen. We will come with the next in the next week with the new chapter. Thank you very much.